the very first question when you're thinking about organizing your loved one's care is what care is required? And that's going to be dictated by your loved one's needs. A person who has ALS, their needs might be very different from a person who just had a hip replacement. And the person who had a hip replacement might be very different than someone who has moderate Alzheimer's disease. The second question that follows after you know what care is required is, where can this care be provided? Answering that question, that could be, well, in my loved one's home, or it could be in my home, or it could be in an assisted living facility, or it could be in a skilled rehab center, or it could be in a dementia care unit. I mean, all of those things really come back to what care is required, where can it be provided, who's going to provide it, how are you going to pay for it? And that question, how are you going to pay for it? Unfortunately, I don't think it should be this way, but unfortunately, sometimes the payer dictates the answer to a couple of those other questions. So if the insurance company covers something or doesn't cover something, that may affect treatment options, that may affect where the care can be provided. So how are you going to pay for it? It could be private pay, out of pocket. It could potentially be your health insurance. But if we're talking about long-term care needs, it's probably not going to be your health insurance. Maybe your loved one has long-term care insurance, which is a different type of insurance, and that would cover long-term care needs, which would be things like home care or potentially care in an assisted living facility. Or there might be a government program such as the VA or Medicaid that will help to pay for that care that is needed. Those are the main questions, and those really drive getting organized for care for your loved one.